We are done learning about necrosis and apoptosis in detail. Now, we still have few newer cell deaths that we need to know about. They are necroptosis, pyroptosis, pharoptosis, and anoikis. Starting off with necroptosis. Necroptosis, as the name says, it is formed from the combination of two words, necrosis and apoptosis. It is, in fact, a hybrid of necrosis as well as apoptosis. Cause in necroptosis, you get to see morphology of the cell like necrosis, but mechanism of cell death like apoptosis. That is why it is a hybrid between the two. Morphology of the cellular changes like necrosis, but mechanism of cell death like apoptosis. That means you get to see cellular swelling, you get to see disruption of plasma membrane, and whenever there is disruption of plasma membrane, the intracellular content leaks out and it obviously triggers inflammation. So there is inflammation as well. As for mechanism, yes, the process is a programmed cell death, just like apoptosis. It is a programmed cell death. But, and there's a huge but here, this programmed cell death is caspase independent. That is, it is not dependent on caspase enzyme. So it is caspase independent programmed cell death. So recently, or more appropriately, people use the term programmed necrosis for necroptosis. Because like necrosis, the morphological changes are seen in the cell as it goes through the cell death, and the mechanism is well programmed within the cell. So it is a programmed necrosis, which is independent of caspase, not dependent on caspase. Like apoptosis, necroptosis is also physiological as well as pathological. What are the examples? Physiological necroptosis, example, formation of mammalian growth plate. Pathological necroptosis examples, liver cells during steatohepatitis, acute pancreatitis, then neurodegenerative disease, for example, Parkinson's, and caspase inhibitor producing virus. So if you have a virus that produces caspase inhibitor, obviously it is not gonna die by apoptosis because it is caspase independent. In that case, you need necroptosis, because in necroptosis there is death of the cell, programmed death of the cell, which is caspase independent, not dependent on caspase. So even if the virus is resistant to caspase, it doesn't matter because the process does not involve caspase. And the most famous example is cytomegalovirus. It produces caspase inhibitor. That is why it does not get killed by apoptosis. Instead, it gets killed by caspase independent method, caspase independent programmed cell death, and that is necroptosis. Again, I said that the mechanism is similar to that of apoptosis. The mechanism is similar to that of initiation of the extrinsic pathway of apoptosis. In initiation of the extrinsic pathway of apoptosis, what did we have? We had a receptor on the cell surface called Fas receptor, which combined with the ligand, the Fas ligand, which led to the formation of a death domain, and then this death domain was responsible for the death of the cell. Here also, on the surface of the cell, there is a receptor called TNF receptor 1, to which binds a ligand called TNF F, which leads to the formation of a protein complex. This protein complex has three major components. They are RIPK3, RIPK1, and caspase 8. Wait a second. I just said that necroptosis is caspase independent programmed cell death. Then why is there caspase here? There is caspase in the protein complex, but this caspase does not activate. Since the caspase does not activate, it does not function. So it is there, but it is functionless. The main function is carried out actually by RIPK3. So this RIPK3 is the main part. RIPK3 is responsible for phosphorylation of MLKL. So MLKL gets phosphorylated. You get MLKL, which is now phosphorylated. Phosphorylated MLKL is responsible for the disruption of the plasma membrane. It brings about plasma membrane disruption. Plasma membrane disruption. And as I said earlier, when plasma membrane gets disrupted, the intracellular content, it leaks out, which triggers inflammation, leading to inflammation. So this is necroptosis for you.